Some people think that Harry Styles is actually bald, like me. They say that he's wearing a wig and that he's actually lost his hair. I'm gonna take a look at his hair and address this conspiracy once and for all. I'll put it all together and let you know what I really think at the end of the video. This one is gonna surprise you. In 2010, at the age of 16, Harry has what looks like to be a Norwood 1 pattern with strong anterior temporal peaks and little to no frontotemporal recession. In 2011, at the age of 17, this is a common hairstyle for Harry in his teenage years, with his hair coming down and covering part of his forehead. In 2012, at the age of 18, now it looks like Harry has more of a Norwood 2 male pattern. To review some of the basic terminology, we have the widow's peak, and that's this area right here at the center of the hairline. We also have frontotemporal corners, or the frontotemporal recession areas. And of course, we have the temples that are located just south of the frontotemporal corners, and they're right above the sideburn area. You can see that Harry's temples have started to recede laterally. His temples are now further away and pulled away from the eyebrows than they were just a few years prior. He has a strong hairline with some baby hairs present as well. In 2013, at the age of 19, Harry here has a similar hairline pattern. Either he's preserved this pattern naturally, or he may have started on something like finasteride. We know that finasteride has a strong ability to prevent further hair loss in most men. Keep in mind that some men will experience really significant hair loss in their teenage years. I've even seen some Norwood 7 cases in, say, 18 or 19-year-olds. And that's an important reminder when we start to consider doing hair transplants at younger ages. Of course, we have to be careful when offering a hair transplant to a younger patient. However, when someone has such an advanced pattern in their teenage years, what would be the reason to wait even longer to offer them a potential transplant? Something to consider. And I would argue one of the wrong medications to start on when you're starting to see frontotemporal recession at a younger age and you want to prevent further loss would be topical minoxidil. And I have a whole video on why I think that's not a great first choice. But unfortunately, that's where most people start and their hair loss continues. In 2014, at the age of 20, you can see that Harry has deeper recession on the left frontotemporal corner compared to his right. And this occurs in only about 10% of the population. In most people, usually the right side recedes more than the left, and that's true in men and women. So Harry Styles is in the minority with his hair loss pattern. Keep in mind that the younger you are when your hair loss starts, the more potential you have to end up with a more advanced pattern of hair loss at a younger age compared to someone who just starts to thin and recede later in life. This of course makes intuitive sense because if you're already starting to have significant hair loss in your teenage years, how will it look when you reach your 20s, 30s, and beyond? So the population where finasteride has the strongest potential to really help limit progressive hair loss is in this younger population, which of course is the population that's least likely to be A, interested in a medication that they have to continue to take the rest of their life, and B, compliant with the medication because of all the other things that they have going on in their lives at that age. In 2015, at the age of 21, I see no change. And in 2016, at the age of 22, I also see no change. In 2017, at the age of 23, you can see that Harry Styles' crown is still quite strong. Remember that the main areas of the scalp, especially when it comes to the DHT sensitive zone, is the frontal scalp, the mid scalp, and then the crown. The crown on all of us has at least one area of a whorl pattern, and that's where the hair starts to rotate on itself, and that gives the appearance of some subtle thinning in everyone. This thinning is mainly due to directional changes that are occurring around that whorl. You lose that shingling overlap effect that you may have on other areas of your scalp, such as the frontal area. In 2018, at the age of 24, I see no change. In 2019, at the age of 25, Harry is moving towards a Norwood 3 hair loss pattern, specifically on his left side. He's starting to develop more pronounced hairline asymmetry, but his overall hair density is still quite strong. So in my opinion, in a situation like this, he's unlikely to benefit from minoxidil, whether that be the topical formulation like Rogaine or oral minoxidil that we know is more potent than the topical minoxidil, but is only meant to increase the thickness or the caliber of our hair shafts. And as it does this, it gives us more hair fullness, but it's not going to bring back hair in areas where you've completely lost it, like in Harry's case, the frontotemporal corners. So if he came to me for clinical advice, I would say thumbs up to finasteride for reducing progressive loss of those areas and keeping the great hair that he has at this time point. But the use of minoxidil is unlikely to change much for him clinically. It would only expose him to some potential side effects. And the additional recession that we're seeing on his left side suggests that he's either not on finasteride or he's on finasteride, but he's falling into the 8 to 10% of men who continue to see progressive hair loss even on the standard dose of oral finasteride at 1 milligram a day. Some men who are on the 1 milligram a day dose feel like they're doing everything possible to prevent further hair loss, or if they continue to see progressive recession. But oral finasteride in its standard dose will be effective for preventing hair loss in about 90 to 92% of men. The rest might have to consider bumping up the dose of finasteride or switching over to its more potent cousin, dutasteride. The difference is that dutasteride blocks all the isoforms of the 5-alpha reductase enzyme that's blocking the conversion from testosterone to dihydrotestosterone. If you're looking to reduce your hair loss, make sure to check out the products that we have at feelconfident.com. In 2020, at the age of 26, I see no change. In 2021, at the age of 27, I see no change. In 2022, at the age of 28, this is around the time when rumors started to swirl that potentially Harry Styles had a wig or a hairpiece. It definitely does not look like that to me. He still has a natural hairline and his usual degree of recession. He has those finer hairs that are blending into his thicker hairs, which is very natural. And he also has some irregularity along the hairline that's very difficult to recreate with a hairpiece. And that left side being more receded than his right is still very much in keeping with what he had previously. So there's no reason to think that he's now wearing a wig. But in November of 2023, at the age of 29, Harry debuted a shaved head for the very first time. And some speculated that this was a reaction to the release of a Taylor Swift record called 1989 that she released 1 month prior in October of 2023. And in that record, she actually referenced Harry's hair. But maybe it wasn't because of that record. Maybe it was because of something else. In 2024, now at the age of 30, what you see here is that the contour of Harry's left frontotemporal corner now looks different. It looks less angular, it looks less receded, and it looks more rounded and more symmetrical with his right side. However, his temples and his central hairline appear unchanged. So my hypothesis is that Harry's head shaving 1 year prior was actually related to a potential hair transplant to balance out the contour of his hairline. Now, this was a subtle type of hair transplant. This wasn't something involving 3,000 grafts. This was something that may have only involved about 200 to 500 grafts, likely with the FUE or the follicular unit extraction method from the back of the scalp into that left corner. And they likely shaved his head for that procedure. And I think that's why he debuted that shaved head in 2023. If this is true, it really shows the power of today's hair transplant surgery, how it can restore balance and symmetry to the hairline in a very natural way. This wasn't possible in the past, but with today's technologies and the proper artistic vision that I'm always talking about on this channel, it is possible to have a hair transplant and to have nobody notice that you did it. Do you agree with this analysis, or do you have a different take on the hairline of Harry Styles? Please remember that this is a speculative video. We don't know exactly what Harry has done to his hair, but it's looking great.